welcome to the UMTRC's webinar. My name is Cameron Hilt, and I serve as the Program Director for the Upper Midwest Telehealth Resource Center, as well as the Crossroads Partnership for Telehealth. Today, we have Jessica Devine, who's going to be talking to us a little bit about artificial intelligence and virtual care. So Jessica currently serves as the data coordinator for the Upper Midwest Telehealth Resource Center, as well as the Connecting Kids to Coverage grant. Jessica earned her bachelor's degree in public health from Purdue University, and during her time at the university, gained some experience at St. Jude's Children's Research Hospital in Memphis, Tennessee, and was a member of a biomedical engineering team through Purdue's engineering projects and community service. Jessica is passionate about technology for increasing access to care and improving quality of life, especially through integrating biomedical engineering and computer science with healthcare. So Jessica, we're very happy to have you join us today, and I'll go ahead and hand it off to you.
Thank you, Cam, and thank you everyone for joining today. This is Artificial Intelligence in Virtual Care. So the usual funding disclosure for a grant that supports some of my work, but the contents of this presentation don't necessarily reflect the views of the funders. Artificial intelligence builds on many of the efforts that telehealth was already making, such as extending resources, reaching geographically farther, improving quality of care, and improving quality of life. And to more fully describe what artificial intelligence is, essentially it's developing instructions for a machine to take care of tasks. All of our machines, such as a computer or a phone, need these instructions in order to be able to function. So someone at some point wrote code that describes to a machine how to execute different tasks. So you and I, as humans, are able to do all kinds of things with our intelligence, and likewise, we can help machines develop some of these capabilities to do some of the things that we would want to delegate. And so this is based on extensive mathematics at the base level. It's beneficial in that it can spare human intelligence for tasks that necessitate actual intelligence. So for example, there are some things that humans maybe don't want to do that a machine could do instead. And some things that machines are able to do are not as full or complete as humans because we have empathy and sensitivity to be able to distinguish. So we want to be able to spare our human intelligence for the tasks that absolutely need that. We can support accuracy for human tasks by providing a tool. So an example is that with the invention of calculators, humans could have some aid with doing math, but we still have to use our human intelligence to think through how exactly the math works and to be able to move that forward. And so likewise, when we develop artificial intelligence, it's a tool for humans. And we can send machines into places that humans don't want to go. So an example of this is sending robots into combat zones to protect human life. And to get into how it works more specifically, on this screen at the very top, you can see some code. And this is not code that would run artificial intelligence, but it gives you a little bit of an idea of the scripting that makes your machines run. So this particular code is some that I wrote quite some time ago with a cookie recipe. And you can see that there are some phrases in there that you might recognize that look like written English. And whenever we write code, we do it in a way that the humans can understand when they look at it. So some of those notes, and we also do it in a way that machines can understand because they don't have as extensive of capabilities as we do. And so to take that farther into artificial intelligence, essentially AI relies on a lot of code. So the little snippet at the top is just a sample of the extensive length of code that would be required for an artificial intelligence model. And if you're wondering what that code is going to do in terms of how it works, it starts out by using an already existing data set where you can create your own. So if you interact with images, or so for example, with radiology, if you have a lot of images that you want artificial intelligence to analyze, you can use this already existing data set or build your own. And to create the model of artificial intelligence, essentially what it's doing is starting with an idea or some sort of baseline measurement. So in the example that I've tried to describe here on the screen, you might have a lot of pictures of cats and want to characterize them. Are they kittens or are they not kittens? And so how the machine would interpret this is it looks at these pictures of cats in a sense of we upload this into the code that we've written to be able to analyze it. And the machine, much like a human, would go through the process of asking different questions to be able to get to the final answer that we want to come to. So an artificial intelligence model might have a machine first answer, is this picture of a cat older than 1 year old or is it not? And go from there to be able to draw conclusions from that. So an artificial intelligence model evaluates stepwise in much the same way that humans work. We start with one bit of information that we already know, and we can then draw in other information that we know and consider it in different contexts to be able to answer whatever it is that we ultimately want to answer. So with artificial intelligence, it starts out with a low accuracy rate because it's the first time that a machine is doing it. And similarly to humans, when we learn, we often have some growth and some development with that to be more accurate and do it more quickly. And likewise, a machine goes through a similar process. So as it goes through these step-by-step considerations, the accuracy of the artificial intelligence model will increase. And the model also learns how to focus on whatever it is that we want the machine to focus on. So ultimately, it will show results. And so with an earlier example, there are artificial intelligence models that can identify chest x-rays as having some different characteristics. So some common examples that are being used currently are for a machine to be able to look at chest x-rays and determine, is it COVID? Is it perhaps pneumonia caused by a different virus? Or is it a normal chest x-ray? And so these are some of the different considerations that machines use as they go through artificial intelligence. And to disclose some common myths and some facts about artificial intelligence, AI will not take jobs away from humans, but it does open up new jobs that can use different skill sets. So we've seen this before in human history as population shifted from having fewer people left who are farming. Many of us learn different skill sets to be able to do different jobs. And so likewise, we can shift again as a population to be able to utilize this new technology. AI is not going to replace humans because humans have a responsibility as well as an opportunity to control the development of artificial intelligence to suit our purposes. Ultimately, technology should always be developed and used with an end goal of improving quality of life for humans. And additionally, AI is not going to take over the world, but it can aid in improving our quality of life. And the image here on this slide shows you another little bit of what some of the code might look like of having a lot of lines of instructions for a machine to follow. So it's very detailed instructions for artificial intelligence because machines are not smart in and of themselves. They have to have humans tell them how to do it. And so we have the opportunity to describe exactly what we want the machine to do. Some current examples of AI in healthcare are quite extensive. So this slide has a few examples, but it's not meant to be a complete list by any means. Some examples that you might already see are closed captioning. With presentations, there's opportunity with artificial intelligence to transcribe spoken words in real time to aid individuals who, for whatever reason, might prefer or benefit from reading the words on the screen live time during a presentation. There's note-taking during telehealth sessions, which can allow a physician or other provider to spend more time engaging with the patient and to have more active listening. There's research being done with electronic health records using artificial intelligence to increase the speed and capability of reviewing what's in those electronic health records to pull out more trends and increase the amount of decisions that can be made. So a very contemporary example is a lot of models are currently trying to increase the ability to monitor for sepsis, to identify sepsis, and therefore hopefully have better treatments for sepsis. The Los Angeles County Department of Health Services is examining pictures for monitoring diabetic retinopathy development. So in this example, they are able to have these pictures come through their artificial intelligence models and can help doctors more quickly screen for things that they either want to be monitoring the progression of or to otherwise be able to spare some of their time and attention to have more time interacting with the patient and to have the tools supporting them with analyzing the images. There's opportunities with artificial intelligence to equip EMTs to access physicians through telemedicine, so to extend that reach of being able to access care. Robots are a very big area of development that utilize artificial intelligence, and some examples of those include running errands through a hospital, such as delivering things to the pharmacy or otherwise doing some of the tasks that can save energy for nurses. And likewise, robots are being used to assist with surgery. And this is a heavy area of research and development. A common example is having robots assist with C-section because so many tools are used that robots are perfectly inclined to do the very monotonous yet very important task of counting all of those tools to make sure that everything gets back where it is supposed to and that the patient is able to have as quick and optimal of an experience as possible. So on the screen, there's a screenshot. I just Googled robot in hospital, and you can do the same to see some different examples of robots being used. You might have heard of robots moving around to disinfect during the pandemic, and there's all kinds of different applications. But ultimately, robots are another very vivid example of how they can do some tasks to save human intelligence as well as human energy for more favorable tasks. Specifically with telepathology, teledermatology, and teleradiology, with MRI, CT scans, and other imaging, this is an area that extensively stands to benefit from artificial intelligence. So originally with these scans, they were built on mathematics and technology to allow the scans in the first place. In terms of producing the images, that relies on math and statistics to be able to visualize what goes on in human bodies. And so likewise, we can extend the benefit of this by using artificial intelligence and the math and statistics that artificial intelligence is based on in order to have even better capabilities with these scans, to be able to look at more areas of the body, to be able to do so more quickly, to be able to do so with greater detail so that doctors have even more information to be able to make their determinations, and ultimately can extend the access of this in terms of geographic distance. And a question that you might be wondering is, will using AI put my facility at greater risk of cyber attack? And just like any other new technology, whenever we implement a new technology or otherwise acquisition, it does open up risk in the sense that anything else does. If there's more things that exist and more opportunities for bad actors to try to access those, but there's plenty being done with artificial intelligence to mitigate that risk just as much as we would when we implement any other new technology. And so developers are working on the back end to protect against cyber attacks. A very famous example is a woman named Maddie Stone at Google. And she and others who work in positions similar are security researchers. And some of the things that they do are trying to break into their own products before they're released to find any vulnerabilities and therefore to be able to make sure that that is secured before they let it go. So the developers are always working to think proactively and identify any vulnerabilities before they even allow it to be used by anyone. And so this work involves knowledge of software with the intangible code, as well as hardware with the physical components of a device. And the slide here on the screen gives you some idea of some of the code that they're looking at. It's quite extensive and quite thorough to be able to make sure that in a theoretical way with that code, that any hackers are not able to just walk through that door. It's very well secured. And so internally, when we have used this technology, we always want to be sure that the source code has been thoroughly reviewed by cybersecurity professionals. So whether that's you or someone else in your organization, or having that done by an outside source, making sure that someone who's very familiar with cybersecurity has reviewed that code to make sure the code is strong and patched against any vulnerabilities. And then from an external sense, in terms of how we interact with that code, we train users on standards that we're all familiar with to help with cybersecurity, such as not clicking on unknown links, not leaving devices unlocked. And this helps by not allowing any kind of front door entrances for cyber attacks. And we can implement additional safeguards as well, but it's important to always consider accessibility. So for example, there are options with biometrics to help secure devices. So for an example, you might want to implement a fingerprint match before someone would have access to a device, but it's important to consider if this is being used in a hospital setting or in any other setting with employees, if any patients or other individuals might be unable to partake in this with the biometrics, with any variations in their ability to physically interact with that. Password protected is a very common cybersecurity choice, and we can consider if this is dementia friendly in ways that we can aid all of our users to be able to have as easy and enjoyable of an experience of interaction with the technology as possible. So in summary, for mitigating concerns about artificial intelligence, there is important work to be done with this that's being done simultaneously with the development and deployment. And it's important to keep these in mind and to be proactive about addressing them because the benefits of artificial intelligence are already being used by many in society, and we want to make sure that we can continue moving forward in a way that benefits all of us. So considering privacy and cybersecurity are important as we're using it. And considering human interactions is also important to make sure that we're always considering how we can be efficient with artificial intelligence and have all of us able to enjoy high quality relationships aided by artificial intelligence. As far as opportunities to utilize AI, there are many data sets that are available, such as on GitHub, and the images on this slide are screenshots of some searches when someone might search for suicide prevention GitHub. And GitHub itself is an international resource of code and other repositories of data that is free to access. And there are different limitations with licenses and within that, many opportunities to engage and to add and develop either yourself or with other employees or elsewhere to be able to advance the availability of that data and have that accessible for everyone. If the idea of developing it is not as appealing, there are opportunities with using resources that you might already have, such as electronic medical records. And there are options to purchase artificial intelligence that's already ready for deployment that may have been created by an outside company that you may be able to purchase or otherwise use. So there are many opportunities available to be able to interact with this, whether you are interested in developing it yourself or whether you want someone else to do that and for you to be able to deploy that and get in on the benefits. And in terms of benefiting from it, it's important to keep in mind that all of us collect data and we might not even realize it all the time. So with so many things being digital, every image and text is all considered data in the sense that a machine can read that and use it to create a narrative. So with artificial intelligence, we can upload any of that in theory. And so we can be creative with considering how we can utilize the data that we already have available. It's important to securely store that data as we're collecting it. So similar to the considerations that I mentioned earlier, there are many opportunities to involve cybersecurity experts as well as to become more knowledgeable ourselves about how to secure that data as we collect it. And ultimately, it's important not to fear some of this new technology because when we learn how to use new tools, we can benefit from the capabilities of those tools. So today we're talking about artificial intelligence. You might also have heard of the cloud or some other technology that might sound kind of like science fiction, but is available today. It will certainly be used tomorrow because it's already being implemented today. So the earlier that we learn about it, the sooner we can be involved with the development to make sure that it's representative of how we'd like to be able to use it and to make sure that it's accessible to us tomorrow as well. And with that, we really want to emphasize that everyone should benefit from artificial intelligence. And a big area to keep in mind is identifying the training set used for artificial intelligence development. And a really famous example is in 2018, a company boasted that their facial recognition had a 97% accuracy rate. But researchers at MIT discovered that was misleading because the product had a 34.7% error rate for recognizing images of dark-skinned women. And so that's quite a large difference. And you might be wondering, how in the world did that happen? The answer is that the training set was not representative of populations to which the technology would be deployed. So this is important to keep in mind for all kinds of different settings and different uses of artificial intelligence, that we want to keep in mind that our data set should include diversity, because artificial intelligence starts out with these very specific instructions that we give it. And a machine can learn a little bit over time, which is how the term intelligence came to be part of this. But as I mentioned, it doesn't have the nuance or ability to kind of distinguish or have sensitivity or empathy that humans do. So it's really important that we make sure from the very beginning that as artificial intelligence develops, that it's considering diversity. Likewise, that we keep in mind who our product is going to be used for. And ideally, the answer would be that it can be accessible for everyone. So if you're interested in learning more about the particular case that I mentioned here, I've included a URL with some news about that. And to continue on this topic of how we want to make sure that it's accessible, and specifically in virtual care, there are some factors to consider which impact health, which can't be quantified or coded in a way a machine can understand. So certain stigmas or concerns that patients might have as they come into telehealth, they might have concerns that they don't necessarily vocalize to the individual that they're meeting with over their telehealth service or appointment. And beyond that, regardless of whether the doctor is able to understand it, there are a lot of those that a machine will never be able to understand. But we need to keep that in mind because we know that that can deeply impact the quality of virtual care and outcomes. So we need to keep in mind that we should identify limitations of artificial intelligence. We should constantly scan for limitations. We should disclose those limitations, and we should continue that throughout the entire use of the artificial intelligence. Because it's one thing to recognize that there's a problem, but if we don't vocalize that and be transparent about being thoughtful about where artificial intelligence is being used, that can very quickly get swept under a rug or hidden, and that's not optimal. So with that, we should consider if algorithms to determine health account for factors which may or may not be known with virtual care. So adding on to some of those things that are difficult to necessarily identify or articulate, such as stigmas or concerns, there can also be items which we might be very well aware as humans through our telehealth interactions, which we might not think that a machine would miss, but we know can be very impactful on health. So some examples could include geographic distance from a pharmacy, social determinants of health, mobility variations or challenges. And so with this falls back in again if we want to be sure that we are noticing these and keeping in mind how that impacts our interactions with artificial intelligence and any limitations for the use of AI. We want to be mindful for AI for the present and for the future. As artificial intelligence develops, it learns each and every day. And so that's going to impact how artificial intelligence operates in tomorrow in a hypothetical sense. And so with that, we want to be sure that the efforts we're making today are for a just tomorrow. So we hope for diversity in our teams for development, as well as for marketing, all the way through evaluation, essentially from start to finish, because with development, with diverse ideas and perspectives, the artificial intelligence can be developed to take into account items such as having a very diverse data set in terms of what's represented within that data set. We also want, with our marketing, to keep in mind that different individuals might notice different limitations. And so with the marketing, being very conscious as different individuals consider how it could impact different populations in different settings. and as well as all the way through evaluation. When we're evaluating the artificial intelligence, we want to be sure that we don't just have a homogeneous team doing that evaluation, to be able to have more considerations involved. Because to emphasize again that machines can learn like humans, but machines don't have the sensitivity which humans possess. So it's important that we're being involved from start to finish and through the entire process to make sure that the AI we're using today is contributing to a very high quality of life for everyone tomorrow. Opportunities to partner with technology stakeholders can include involving technologists, statisticians, and computer scientists in your conversations, which might not be something that you've done before. In healthcare, we might tend to stick with individuals who don't necessarily have those skill sets, but we can start building bridges to increase our knowledge and our capabilities. So this can start in your workplace. If you work in a place that has teams that include these members, maybe you've never interacted with them and maybe you would have the opportunity to do so. If you don't have the opportunity to connect with any in a way that's immediately apparent, the internet has really opened up opportunities to make connections, particularly professional connections. Within Twitter, there's quite a large group of scientists who will tweet out their research, different code that they're working on, and more affectionately known as Science Twitter, which can be useful for starting some of these connections. There's opportunities with YouTube tutorials, and universities, of course, can be hubs for having some of these professionals that you might be able to reach out to and inquire about starting conversations with or building partnerships. And likewise on the screen, another example of some code. And so to emphasize that while some who work in virtual care might not have ever stopped to think about the code that makes the machine run, it can be very helpful to be aware of that and to be able to have the conversations with the people who in the first place had established the code to make the machines run like they do, so that we can better utilize these tools and help shape their development. If you are interested in hiring employees who have experience with artificial intelligence, some recommendations. If you're seeking someone for perhaps a project manager position or another position, which would certainly be helpful to understand in some sense what goes on with artificial intelligence, but not necessarily spending all of their workday working on developing it, it might be helpful to seek out on a resume items such as having a GitHub profile. So that can include contributing some code to the international resource that's available online to develop code and have different repositories to work in teams, as well as being able to program in some computer languages, some computer programming languages, such as Python, Julia, C, as well as Java, R, SQL, and SQL can all be very helpful. And if you're seeking an employee to actually develop artificial intelligence, you'd probably want to look for all of the things I just mentioned, such as the GitHub profile and proficiency with programming languages, as well as coursework in some math and statistics, and completed projects in some artificial intelligence topics, such as natural language processing, logistic regression, machine learning, random forests. But it is important to keep in mind, especially within the field of artificial intelligence, that there's so much that could be known that not everyone can know all of it. And of course, this is true in every field, but particularly with the rapid pace of technology development, it can be very helpful to start with someone who has a good base knowledge and a desire to learn if they've demonstrated through previous projects that they're capable of acquiring these new skills and knowledge that can be helpful to add on to a team. In order to lead the way for artificial intelligence partnerships, there can be options with tuition reimbursement for your staff so that they can further their own skills, which might look like a bootcamp course available online, or perhaps a master's degree with something pertinent to technology. And there can also be opportunities to partner with a local college or a local high school to offer students real-world experiences. So a lot of students already have in their curriculum, whether they're specializing or not, opportunities with technology and even potentially artificial intelligence. And so you could start some of these partnerships with internships or other short-term projects, perhaps automating tasks which take too much time. And these can be opportunities to both increase your department's knowledge of what to look for in potential candidates, as well as, of course, some of the products themselves, which could aid with development or other improvements within your own department. And of course, students are always interested in getting more applicable experience. And this can be a great way to help move forward and set yourself up for success. And so with this slide, the image here, of course, is a different view of code to kind of emphasize that code can look quite different. And while it can be very understandable with practice and time and attention to it, sometimes you just want someone who is quite proficient with that to be able to create it all and have the outcome to present to you, and you can just evaluate that outcome, knowing that you have professionals who've created the code with their own specialty to be able to partner with your specialty. To move forward with artificial intelligence and virtual care, some good things to keep in mind are opportunities to meet with your current partners, such as holding focus groups to identify the biggest current challenges that you're encountering. You can use in-house skill sets, or perhaps you want to partner with others to brainstorm problem-solving approaches to some of these challenges that you are facing. And a good thing to keep in mind with computer science and code and artificial intelligence is there's always more than one way to solve a problem with computer code. So different coders will probably have slightly different looking code, and it might accomplish the same outcome, even if it looks a little bit different. So again, on this slide, there's another slide of some code. And while these different lines of code would accomplish very different things, you can see hopefully that there's quite a range of how it can appear. And it doesn't necessarily mean that one way or another is better. There's definitely considerations with efficiency and speed. And these are topics that if you have employees who specialize in writing code, might be something that they keep in mind. But for your knowledge with a general approach to virtual care and increasing the use of artificial intelligence, it's just good to keep in mind that there can be more than one way, particularly with computer code. And so going forward, you can implement different approaches that you've brainstormed, and you want to get feedback from partners at every stage of development, because there's a tendency with technology to over-engineer solutions sometimes. And this can often exacerbate tendencies to create technology that might fit really well with the developer's vision of it and might not align with end user accessibility or function in mind. So in our efforts within virtual care to improve quality of life, to improve customer satisfaction, to improve patient outcomes, whatever the case may be for your particular work, we want to keep in mind the end user and solicit their feedback before we've already invested so much time in development into finishing a product and finding out that it's not a great fit, or that the user finds it difficult to interact with, or patients find it confusing. When we engage them throughout the entire process, we are able to create products that align better for what they're seeking and for our purposes as well. So ultimately, within artificial intelligence, there are many opportunities to be creative, to think outside the box, and to involve many different stakeholders throughout the process to make sure that we're able to achieve the benefits that we're looking for. So as you go forward from today, I hope that you take away that artificial intelligence can make your life easier, and artificial intelligence can improve the quality of your services. Hopefully you're already familiar with the UMTRC, but there are always lots of ways to connect with us. So thank you so much for coming today.
Thank you, Jessica. We really appreciate your perspective on this. And, you know, we want to be able to open it up as well to individuals that have joined us today to ask you any questions they may have. So please feel free to utilize our Q&A feature or our chat, and we can ask these questions for Jessica while we have her here today. And I can kick us off with a question while, others are kind of formulating their own questions. Has artificial intelligence also been done to help detect and prevent fraud?
Yes, that's an excellent question. Absolutely. So there are many different uses currently for artificial intelligence that can consider some of the context for how money's being transferred or how money's being used. This has some applications within public health to trying to identify and prevent human trafficking. And there are certainly many extensions that can come off of some of these uses of artificial intelligence to detect fraud to be used in many other areas of human health as well.
It's interesting because, as you talked about, not being fearful of, opening up to artificial intelligence with cyber attacks specifically, also that it's actually being utilized to help prevent some things like fraud and cyber attacks is also important to, think through as well, it kind of has both sides of the coin there.
Yes, definitely. Great thought.